What's going on, guys? We're back again. Talking to someone today, just finished a Skype call with him. About 2 months out from a contest, recovering from either a disc injury or a nerve root injury. Not really sure which, I haven't been able to get my hands on, but lots and lots of nasty leg pain associated with flexion. You know, they were squatting, heard it pop a couple weeks ago, and then just massive amounts of shin pain. You know, screams at night with pain down that leg, can't sleep, you know, throbbing, stabbing. A little better once you're up throughout the day, but absolutely awful injury. I've seen some physio, you know, not sure diagnosis, they just know I've got some neural stuff going on from your back affecting L4, L5. So that's what we're working with. Now, they were asking, what can I be doing? What can I be doing to help this, to speed this along? So there's a very important principle we have to talk about with regards to neural injuries, be them disc related or nerve root or combination, whether you've got, you know, disc bulge or a nerve root traction. Basically, we need to get the concept of the sciatic nerve in place. So we know it exits low back, L4, L5, S1, 2, 3. All those 5 branches merge. We'll run down to the glute, piriformis, hamstring, down into the calf. You know, we'll branch off at the posterior aspect, just above the knee, split into your tibial and peroneal nerves, respectively. So we need to think about the nervous system as one big whole unit. So I'm affecting that sciatic nerve in some way or another. When I pull my toe up, you know, picture that rope of nerve tissue going back and forth through the leg. That's going to have an effect on it. Same thing when I pull my head up and down. You know, one big continuous system. All plays into effect. So if you've got an area of tension, say in your hamstring, where that nerve exits the back, runs through, it'll get clamped down, almost like a kink in the garden hose, if that makes sense. So when you go to kick or slide and glide, particularly anything that involves a forward bend, and that nerve gets caught up in that tight tunnel of tissue, you're going to get your back pain because it's going to tug right at its origins. So what can we be doing? Well, the first thing we want to do is loosen off all the muscular components that surround that nerve. So, you know, that's where stretching falls short in this case. You know, if you've got a disc injury or nerve root injury, try doing that. It's not going to happen. You won't be able to get your leg up in this position because there's too much neural tension. Particularly if you pull that toe up or bend down, it'll exaggerate it more. But what we can do is get into the soft tissue, try and unkink that hose, if that makes sense. So we feed lots of slack into the tissues that surround the sciatic nerve. So then when we move and bend and kick and straighten and squat, all of a sudden that nerve can flow freely through that meat tunnel, as Kelly Starr would say. So we're going to take our lacrosse ball, and I just took this one from an old MWAD. Pop it under the hamstring, you know, lean on it, put some weight on it, shift back and forth, and kick. Just like that. Back and forth, give about 100 reps, 2 minutes, something like that. Just kick and straighten, beat up that tissue. Now, I had the misfortune of having an L4 nerve root traction about a year back, absolutely awful. I got more bang for my dollar hitting over by the biceps femoris, but still get in semimembranosus, tendinosis as well, but really hunt around that lateral aspect of the hamstring. While we're here, let's do the glutes. Pop into the glutes, get in there, get into piriformis. This time, let's add a rotational component, back and forth. You'll find lots of tight bits in there. Hunt around for those, same thing. 50 to 100 rotations, or at least 2 minutes. Now, when we talk about this concept of neural tension as well, we also need to incorporate things that are going to slide and glide that nerve. So, neural sliders, gliders, tensioners, there's all kinds of different variations on them. But basically what we want to do, again, is slide that nerve through the tissue, just so it can slide easier when you do your movements. So all we do, I'm going to have this leg up just to keep my low back happy. What I'm going to do is pull that leg up and the toe up. That's the key component. That toe and ankle come up. I can pull, and then I point the toe and straighten the leg. So this is my floss, just back and forth. Okay, and this is going to get that sciatic running back and forth into that tunnel. Now, the key is, again, that ankle maneuver is what we call our sensitizing maneuvers when we're doing actual neural tests. So if you're doing a straight leg raise, you know, you add in that bit of dorsiflexion just to put more tension on it. We use that as a diagnostic, but for an exercise purpose, we go up with the ankle, down with the toe, back and forth. Try 20 of those, see what happens. Now, interesting note, this will actually clear up a lot of tissue problems that might be nagging you. So if you've got, say, an Achilles tendinopathy, glute tendinopathy, maybe a hamstring insertional problem, and it's not going away, and you're doing your soft tissue work, there might be a neural component to it. So these sliders and gliders will actually help with that. Multiple times in the last couple of months I've seen this work on these annoying Achilles problems that don't go away. You know, you're grafting the calf, you're doing lots of dry needling, you're taking care of your soft tissue business. It should be responding, but it's not. There's probably a neural component. So check out the corresponding segment of that muscle that has the problem. Needle around there. If you're a physio, get your lacrosse ball, your peanut in there if you're an athlete, and take care of that spinal segment and add in some neural flossing. Chances are that will help the pain you think is only coming from the soft tissue. So give that a go, guys. Hopefully that helps with your flexion-based issues. Do a little test retest here. You know, put your feet together, hands on the thighs, slide down. If you've got an actual problem, you won't be able to get very far. Do the sliders, do the gliders, do the ball up in the hamstring and glute retest. I bet you'll find a huge difference. So take that with you, guys, put it to work, and enjoy.